Hello all, I am Dr. Walter from SNS College of Physiotherapy, and today we are going to see a design thinking video. So what is the new technique which we are going to apply today? So today, as we have seen already in the last month, a debate based on exercise therapy and electrotherapy. And this month we are going to see a debate, might be a controversial, but conclusion will be a good thing. That is ortho rehab and a neuro rehab. And here I present my two mentees. That is, one is Benjamin Thomas and one is Prasanna Arasu, and both of them will be delivering a fireful based on the ortho rehab and the neuro rehab.
Yeah, today I'm going to talk about orthopedic aspects, and we are dealing about the orthopedic rehabilitations, and we are dealing about pain relief cases and post recovery aspects. These are the topics going to cover today.
Okay. From neuro aspect, we do cover the aspects of neurology conditions where the patient have Parkinsonism, and from Parkinsonism to cerebral palsy or spinal cord injuries where the patient lost his hope towards recovery.
Yeah, sure. But we also provide treatment duration in the shorter period, and we can get a larger amount of the community-based disease and conditions like osteoarthritis, and we can give a profitable and faster recovery.
Yes. It doesn't mean that the faster recovery gives the patient the satisfaction they need. In the sense, we have in the neuro rehab, we take the longer time and the good relationship with the customers, the patients, which gives the patient psychological motivation to get recover from these neurological conditions.
Yeah, sure. But that is the most important thing we want to concern about that. We want to give a faster recovery to manage their lifetimes and to get a reback into their life states.
Yes, I agree with that. In specifically in the neuro conditions, we need to retain the patient's neuroplasticity and able to control the motor functions and the sensory control of the patient. So it is very hard to improve the patient in the shorter period of time. So it takes a longer period of time.
Yeah, I agree with that. But we are also using a various modalities and treatment procedures like manual therapy, orthopedic, and these are the very conditions to treat easily and in the faster level aspects.
Yeah, I do agree with that, bro. Actually, you see here, it is mainly based on the repetition movements and the patient's ability towards mostly based on the emotional content. If the patient loses hope due to the paralysis of every limb or weakness of something he has. So in neuro rehab, the patient needs the motivation to get rehabilitation. So here we have the manual therapy and some kind of PNF, and we do develop the neuromuscular activity of the patient by repetitive movements, so the patient can able to recover in a faster manner.
Okay. And we are using SWT to treat the patients and relieve the pain sectors, and we are using informations. These are the main advantages aspects in our orthopedics.
Yeah, you see, the child who is born with cerebral palsy, it's very hard for the child to get recovered. So here we have NDT and MCIMT to treat the child, which helps the child to recover from the develop milestone delay to get to the normal level of their development.
Yeah. Do you know one thing? A old man who has surgery like a ACL tear, and after post surgery, we give a super kind of rehabilitations. Now he is attending her daughter's marriage.
Yeah, I do agree with your point. In the sense, we do give the patient the emotional support, where the patient who lost their emotional support or cognitive issues, where the patient we have in neuro, they lost their, what can I say, the emotions are lost, the functions they have lost, and these people can't able to make the works they have done earlier. So it leads to frustration and lack of motivation for the people to get recovered. So as a neurophysiotherapist, it's an important job for the physiotherapist to gain the emotional and motivation to the patient.
Yeah, I agree with that. But we also are facing stress and like self doubts and lack of motivations. See, every patients are facing these kind of problems and lack of motivation in order to any kind of diseases, not only like a neuro clinic aspects. If the patients are, attend the recent accidents, then they also feel so tired and lack of motivation to walk again after. And there is a recovery time period where they get most stressed and leads to the confusions, lack of motivation and depression.
Yeah.
I will conclude this debate with my solutions and questions. Okay. Will you think that the neuro patients will get back into the older life with a proper and 100% recovery?
If you think so, I also need to conclude this with a question. Can an orthopedic physiotherapist can able to recover a patient with neurological deficit in ortho condition. Can you able to record them? Okay. Let's straightforward this question to the judge.
Okay, so for past 4 to 5 minutes, we had a beautiful debate based on the neuro and the ortho rehab. And coming for the conclusion, like both of you need to understand a single thing. As a physiotherapist, we need to work in a multidisciplinary team. So that is ortho rehabilitation and of neuro rehabilitation, and combined with the other teams will be combined to produce a proper lifestyle for a patient. Our goal is to give a proper life, that is a proper ideal activity for a patient. So it is not about the I am the ortho rehabilitation, no, I am the neuro. That is not correct. But this debate produces a harmony that both of them should work together to produce a thing. So today we are going to see another video, that is a case study video. So I need your presence to understand if a patient is coming with an ortho condition along with a neuro deficit. So how a physiotherapist will be going to work and deliver a proper physiotherapy treatment. So we'll meet on next video with a case study. Bye guys, and thank you all.